Subcommittee is going to hear briefings from our staff from the Department of Corrections and the Department of Juvenile Justice. The Department of Corrections will provide updates on a number of topics, including recent facility closures, the transition of Lawrenceville Correctional Center to state management, and the Correctional Officer Career Pipeline pilot established by the General Assembly. In addition, the subcommittee will receive a summary of a recent study on staffing security levels, and the 2024 General Assembly directed the department to assess its use of staffing posts with the goal of maximizing efficiency in a light of lower inmate population in recent years. As requested by the subcommittee, the Department of Juvenile Justice will present on changes in the use of alternative placements and rehabilitative programming for youth in state custody. The budget required a report from the department evaluating how its programs align with the national evidence base as recommended by JLARC, and the subcommittee looks forward to receiving background on the topic today and receiving a more complete written report as soon as possible. Before we begin hearing from our presenters, do any members of the subcommittee have any opening remarks or questions? Okay.
Thank you.
Okay, well, I'm going to now call up to the podium Joe Walter, the Deputy Director of Administration for the Department of Corrections, to begin his presentations. Welcome.
My name is Joseph Walters. I'm the Deputy Director for Administration for the Virginia Department of Corrections. Let me begin by saying that Director Chad Dotson sends his regrets he cannot be here with you today. He's in Florida on department business, but he asked that I share with you. He's certainly available in the future if you have questions or would like to discuss any of these issues with him directly. It's a pleasure to be here with you today, and we appreciate the opportunity to be able to discuss the agency's activities with you. This afternoon, I'm going to provide you with updates on 5 topics specifically requested by your staff. Mr. Chairman, the topics include updates on facility closures, the Lawrenceville Correctional Center transition, electronic healthcare records, the Virginia Community College System VCCS plan, and our staffing study. So beginning with the facility closure, sir. The VADOC, the Department of Corrections, closed 4 facilities on June 30th, 2024. These included Augusta Correctional Center, Haynesville Correctional Unit number 17, Stafford Community Corrections Alternative Program, which is a CCAP, and then Sussex II State Prison. So we continue to work closely with the colleagues at the Department of General Services regarding the disposal of the associated real property, the surplus property, and we also work very closely with the local governments where the facilities were located, including having a town hall in the town of Craigsville. Of the employees impacted by the June 30th closure, I am very pleased to report to you that all eligible employees desiring placement opportunities with the Department of Corrections were successfully placed. That represents a total of 301 employees. 64 employees took advantage of enhanced retirement benefits, and 42 employees took advantage of the severance payout. So in the next slides, I will discuss the specifics of each facility closure and the impact on the agency. So we'll begin with the Augusta Correctional Center. So the building and land occupied by the former Augusta Correctional Center is to be sold as authorized by the General Assembly and as approved by the governor. Excluded from the sale specifically are 2 parcels of land. These include the tax parcel containing the water treatment plant and the portion of another tax parcel where the water tank is situated. Chapter 127 of the 2024 Acts of Assembly direct these 2 parcels are to be conveyed by VADOC without monetary consideration to the town of Craigsville, and we work closely with the town to facilitate that. The deed to convey the water treatment plant is being prepared now. The transfer is to be completed by December 31st, 2024, and it is on schedule. Plans are also under review to convey the water tank and the easements. The transfer of the water tank and the easements should occur in the first quarter of 2025 as we're working on the necessary completion of the easements. DGS, the Department of General Services, is working with Augusta County for a decision on their interest in the property, and so DGS can determine the necessary marketing and other things if the county is not interested in taking ownership of the property. The DOC actively participated in a town hall meeting, as I mentioned earlier this year. We worked through the closure issues at the request of the local government, also the members of the General Assembly from that area. In attendance at that meeting were representatives of the governor's office and the agency, Senator Obenshain, Delegate Runyon, and local officials. We continue to stay in contact with them, particularly the local government. HQ, our headquarters human resources staff visited Augusta Correctional Center on a weekly basis to meet with staff, to aid them with the transition and their important decisions about the future for them. This was particularly important with Augusta because of the relatively remote geographic area where the facility is located. There are a limited number of DOC facilities in the immediate area. Therefore, we really spent quite a bit of time with the staff trying to help them to determine placement opportunities or future decisions for them. So of these staff at Augusta, 100 of the eligible staff at Augusta, 133 were able to be placed within the department. 19 took advantage of enhanced retirement benefits, and 19 took advantage of enhanced severance payouts. So moving on to Haynesville Correctional Unit number 17. So I think some of you may have visited Haynesville Correctional Unit 17 in the past. This is a relatively small facility. It's located on the same parcel of land as Haynesville Correctional Center. It's almost across the parking lot from the Correctional Center itself. So the department's intentions with that structure and those buildings are to repurpose the administration building as offices and training rooms for use by the major facility that adjoins it. The estimated cost for the repurpose is $25,000. The remaining buildings will then be mothballed. So the estimated annual cost to maintain the mothballed buildings in habitable condition and the surrounding grounds is approximately $75,000. This is a small facility. We hope to maintain that for potential future use as a field unit or potentially as a CCAP based on the continued. Yes, sir, I apologize. Mr. Chairman, a CCAP, that's an abbreviation for Community Corrections Alternative Program. That's a community-based program. Yes, sir. Thank you, sir. I apologize. For that program there, and that's based on the growing interest of the courts in those programs. The General Assembly as recently as last year took up legislation about that. That was House Bill 1268, Delegate Delaney's bill. So that's the intended use there. The small staff at that location, we were able to place 21 of their staff into positions within the department. Most of them went to Haynesville Correctional Center, the proper facility. 10 accepted enhanced retirement benefits, and 2 accepted the enhanced severance payouts. So the next facility, Mr. Chairman, was the Stafford Community Corrections Alternative Program, Stafford CCAP. With that facility, the department intends to revert ownership of Stafford to the Virginia Department of Transportation. The department took ownership of the property through a 1984 agreement with VDOT. It came from the right-of-way division within VDOT. VDOT has already notified the agency of their intent, asking us to transfer that back to them, and then the VDOT will work with the community to determine future use. We are in the process of doing that. So the property will transition from the Department of Corrections to the Department of Transportation, who will then work with the community for future uses. And that's the property, because of that unique circumstance, the property is not subject to the requirements of 2.21156, the surplus property code sections. So of the workforce there at Stafford, 16 accepted placement opportunities within the agency, 8 accepted enhanced retirement package, and 10 accepted the enhanced severance payout and moved to other career opportunities. So that's the future of Stafford CCAP. The final facility that I'll speak to, Mr. Chairman, is Sussex II State Prison. So Sussex II State Prison, I know that several of you have been to Sussex. That is a facility of 540 acres. Sussex I and Sussex II State Prisons are co-located. They share parking, they share several infrastructure facilities. The heating and cooling systems are shared, the fire alarm systems are shared, although we're moving to separate them now, but they share those shared systems. And then likewise, they both take advantage of water and wastewater treatment services through Sussex Service Authority. So our intention with Sussex II is to mothball the facility for future use. The estimated deactivation cost for the facility in FY25 is approximately $705,000. And then the estimated annual cost to maintain the mothballed facility and the surrounding grounds is approximately $650,000. When we notified the staff of the closures, each of the members of the executive team went to one of the facilities. I went to Sussex the day we notified the staff, met with them. I will say that they certainly understood the decision. All were very pleased with the opportunity to remain, or had to have opportunities to remain employed with the agency, and we were successful in placing 131 of their staff into jobs with the Virginia Department of Corrections. 27 of the staff members elected to take enhanced retirement benefits, and 11 accepted enhanced severance payouts. We're working closely with the community there, and generally all 4 of these closures have gone very well. We're very pleased with the number of staff we were able to offer employment opportunities for, and certainly with the relationship we were able to build and maintain with the local governments. So that's the status on the 4 facility closures.
Before we move on from Sussex to I was just curious, it's $650,000 a year to maintain it. Is there any flexible guess as to when it might be needed again? That would be if our population increases, or?
I don't have a date for you, Mr. Chairman. I apologize.
Right, but I mean, is that something that we're thinking is like within 5 to 10 years that we might need it if there was an increase in crime or sentencing, or?
Mr. Chairman, I believe that to be accurate. I think the forecasting has been done, and I can't speak to what those numbers are.
Okay.
But that's my understanding. Yes, sir.
Thank you. I interrupted you. You were
No,
going
sir.
to Lawrenceville.
No, thank you, Mr. Chairman. So speaking to the Lawrenceville transition, so at midnight on July 31st, 2024, the DOC's contract with the GEO Group concluded, and on August 1st, 2024, Lawrenceville Correctional Center transitioned to full state operation and management. So as a reminder to the subcommittee, Lawrenceville Correctional Center was built in 1998 as the Commonwealth's first and only private prison. It was originally built by Corrections Corporation of America. That company is now known as Core Civic. GEO Group operated the facility from 2003 to the conclusion of the contract a few months ago. VADOC successfully partnered with GEO in the locality to ensure a safe and effective transition, and VADOC made the final payment for all services on November 8th of 2024. The GEO Group is contesting the assessment of liquidated damages in the final payment, but we're working through that with them right now.
What kind of damages were? This is for improvements or lack of maintenance, or?
No, sir, Mr. Chairman. The liquidated damages are assessed for minimum staffing levels. So they're required to have minimum staffing levels in each of the types of positions at the facility.
Yeah.
If they drop below that staffing level, they're assessed liquidated damages for dropping below those levels.
Okay.
It is not for facility damage or anything of that kind.
Thank you.
Thank you, sir. So again, we're making good progress with the transition of Lawrenceville to state management, including changes in the population and in the mission. So we're excited to talk about the future of Lawrenceville. Specifically with Lawrenceville, what Director Dotson envisions and what the agency is moving towards is something that we're calling the Virginia model. This is an incentive-based prison for inmates who comply with directions and procedures. The incentives reward good behavior and discourage negative activities. We've been to several other states. Staff have gone to Florida. They've talked with staff from other states where these sorts of facilities are in use. We see very positive results in those other states and expect to see the same here. The facility is going to have skill-based program training, quite a bit of skill-based program training, education and counseling services, and many other opportunities to support inmates who actively seek those chances to effectively prepare for their release. The requirements for transfer for Lawrenceville, the inmates have to have certain requirements to transfer to Lawrenceville. They have to be charge-free for more than 4 years, and they have to demonstrate good behavior. Inmates who participate in prohibited activity are automatically removed from the facility. To give you an idea of the interest from the inmates, we advertise the opportunity. We've filled the facility at this point, and we have a waiting list of 1,800 inmates who would like to go to Lawrenceville to take advantage of these opportunities. We haven't vetted that list, so the number is probably lower once we vet it, but it does demonstrate quite a bit of interest from the inmate population in that sort of opportunity. So we're very excited about that, and I'll tell you a little bit more about what's going to happen to Lawrenceville at Lawrenceville in the next few slides. So with Lawrenceville, we'll speak to staffing first. We have here for you the information on the staffing at Lawrenceville. We did transition a few months ago. Of the GEO staff that were employed there, we were able to hire 111 of their staff, 74 of their security staff, and 37 of their non-security staff. We have a total of 160 vacancies, 135 security vacancies, and 25 non-security vacancies as we are standing the facility up. The bottom information on the chart sort of reflects the department's overall average to give you some idea of where they are, of where we are there. We have 1,606 security vacancies, an overall rating or vacancy rate of 18.7% agency-wide. What are we doing to fill those vacancies, Mr. Chairman? Several things. So to give you some examples, in September, we held a local hiring event in Lawrenceville with a Golden Leaf Community Hiring Event, reaching out directly to the high schools, to the local community colleges, as you're going to hear about in a later aspect of the presentation, but working with the local community, the local educational institutions, local civic groups, and others to hire people from that community to work at the facility. In October, we had an event at Mecklenburg County High School with the senior class. We went out and talked to them. Our recruiters talked to them about career opportunities in corrections, in security, but likewise in our non-security roles, the various things we do with building and grounds, with maintenance, with information technology, healthcare. We are, with the exception of the United States military, we're one of the few employers that really we hire people to do everything from agriculture to healthcare, education, security, law enforcement. You have an opportunity for a career in the Department of Corrections no matter what your interest is. So we really stress that to our applicants. We've done fall radio ad campaigns, billboards in the Petersburg and Emporia area. We've averaged 2 hiring events a month dedicated to Lawrenceville since September. And we're identifying targeting events specifically for Lawrenceville in that community and the nearby community for January and into February with community engagement opportunities, partnering with the local leadership team and local government. Over the past couple of months, the past 3 months specifically, we've averaged about 35 applicants per month for corrections officer positions at Lawrenceville. We've extended 51 offers, and we've managed to employ 26 of those individuals into jobs at Lawrenceville as correctional officers. So that's a good effort for us, and we certainly have room for improvement. We want to fill those vacancies, but we are definitely making progress. And what we hear from the staff anecdotally is that they're very pleased with the environment at Lawrenceville, with the inmates that are present, the programming opportunities that are there, and getting good feedback from our partners in the locality.
I had a chance to visit there a few, I guess it was a month or so ago. The population, though, is totally transitioned. There's, right, people who were incarcerated at Lawrenceville under the prior management have been moved to other facilities?
Yes, sir, that's correct,
Okay.
Mr. Chairman.
Okay, so what percentage of, how full is it compared to how it will be?
We have, as of today, I think we have about 780 inmates there.
And do you know the capacity by chance?
It was built for a capacity of about 1,575, I
About half.
believe, but we have buildings down right now for maintenance. Those are housing units
Yes.
that are offline. So I know we have one housing unit offline, and with a facility that remains operational, what we generally do is we will take one housing unit offline, completely redo that one, move inmates into it, then move to the next one. So it'll take about 2 years to finish this process, but we're in the process now to do that, and we're bringing up the inmate population there.
Thank you.
Yes, sir. Thank you, Mr. Chairman. So the next slide I have is just some information for you. I wanted to speak for a moment to what we see in terms of changes in inmate behavior and drug-related infractions. Importantly, and I apologize, I know this chart is a little small and it may be difficult to read, but if you'll notice with the level 100 drug-related charges, our charges are down 88% at Lawrenceville. The level 100 is the more serious offenses, and those are drug-related specifically. And then the rows below that, you see the broader categories of level 100 and level 200 offenses. So for the level 100 offenses overall, they're also down 80%. To give you some examples of what level 100 charges are, those are things like possession or use of a weapon, physical assault with injury, sexual assault, fighting with inmates causing bodily harm. And then likewise for the level 200 offenses, they're down approximately 86%. Level 200 charges, just to give you some examples there, would be things like disobeying an order, disruptive behavior, lying or giving false information, or possession of contraband. So those are likewise down 86% at the facility. And that's over the 3-month period, the last 3 months of this calendar year versus the 3 months of the previous calendar year.
With a totally different population now.
Mr. Chairman, that's
Okay.
correct. Yes, sir.
Thank you.
Yes, sir. So moving at this point, sir, into an update on the EHR implementation. This is the electronic health record implementation. So the agency is very excited about this project. This is something that we've been working towards for more than a decade. Our healthcare staff is, they're thrilled, to be frank. The EHR project went live on November 12th, 2024. We began working on the project earlier. That was our go-live date for our first facilities. We began the project at our women's correctional facilities. That includes Fluvanna Correctional Center for Women, Virginia Correctional Center for Women, State Farm's Women's Work Center, Chesterfield CCAP, again, Community Corrections Alternative Program, and the Central Virginia Correctional Unit 13. We continue to work with our colleagues at VITA and DOC and the EHR vendor, who is NAFCare. Been working closely on the implementation, including on issues that have occurred over the last 2 weeks as we stand up. Friday of last week, I went to Fluvanna Correctional Center for Women. I talked directly with the nurses. They're very, very pleased with the electronic health records. So, Mr. Chairman, just to be frank, we were in an environment where everything was on pen and paper. So doctors and nurses were taking notes on paper, which is something that you probably don't experience in your health settings. We're now in an environment where they're entering those records electronically. That is a generational step forward for us. So the nurses are very, very pleased. That aspect of the new system is working quite well. We will keep our paper records. So historically, those old records that were on paper, they'll remain as historical use. Everything new from the point of implementation forward goes on electronic records.
Those are just at the facilities that we started at on November 12th?
Yes, sir, that's correct. So it's the 5 women's facilities is where we begin the rollout. We start the implementation. We have lessons learned. We do training that permits us to train the trainers. And then the plan is that we will go live at all of our facilities in the spring of 25.
Thank you.
Yes, sir. The only issue we're having now, Mr. Chairman, is just with the EMAR, which is the Electronic Medication Administration Record, which is one module in the Electronic Healthcare Record System. So we're working through that with the vendor now and with VITA. The vendors stepped to the table, very pleased with the relationship with the vendor so far and with the support from VITA. So just want to put that forward as well. But so far, things are going well. So,
thank you.
In terms of funding, Mr. Chairman, to speak specifically to that, the legislative language requires the department to utilize non-general funding first. We have funding that we have available from Contract Prisoners Special Revenue Fund. That's the sale of beds to the Virgin Islands and to Hawaii. We implement that has to be used first. That balance as of the beginning of FY25 was $6.9 million. That's been dedicated to the first use. And then based on the expected expenditures for implementing EHR, which is $14.7 million in FY25, another $7.2 million in FY26, we project sufficient general fund and non-general fund allocations to cover the cost of implementation during the biennium. We are on budget. As previously presented, and we certainly appreciate the opportunity, we've spoken with your staff about 9 months ago, that there will be an annual funding shortfall of approximately $2.6 million that will begin in FY27, and that will support ongoing software licensing fees, cloud hosting, maintenance fees, personnel, data access projection, integrations, and other annual costs. But there is sufficient funding for the full implementation during the biennium. The next slide just breaks this down a little bit. It's some information on what we have spent to date. We have spent a little more than $8.3 million to date, Mr. Chairman. And to tell you what those monies were spent for, about $6.5 million, 6.612 was spent on licensing and hosting fees. That's for the initial year and then FY25. And then we've had 2 deliverables during this period. The first is planning and project start, which was about $750,000. And then the deliverable 2 was requirements and design, which was $1 million. So that takes us to the 8.3. And then we have some internal costs as well for contractors and other folks. Again, as I said, we remain on budget within the budget of $22 million. So that
before we move on to the workforce issue, I just wanted to ask, what's going on at Red Onion? Can you give us a report on that? There were inmates protesting, doing themselves harm, or what's the status of that?
Well, I can offer you a few comments, sir. And Director Dotson, I know, plans to speak to that directly to the House Public Safety Committee next week. He's speaking on December 16th. Mm-hmm. On the 27th of November, he issued a statement, and I'm sure you've read that statement, but there were 6 inmates who burned themselves using improvised devices. They were created by tampering with the electrical outlets in the facility. The inmates did not set themselves on fire. There was no self-immolation. As some reports have suggested, the inmates were treated for burns at the department's secure medical facility at VCU Medical Center. They were cleared to return to the facility. Some did not require outside medical treatment. All 6 inmates were referred to mental health staff for treatment, and several of these inmates have a history of engaging in self-harm.
Okay. Before we continue, I wanted to recognize Senator Hashmi. I think she had a question along those lines.
Thank you, Mr. Chair, and thank you for the comments. And I know that Director Dotson has sent us a statement, and I've certainly taken a look at that. But over the past several months, all of our offices have been receiving letters and issues of concern from family members and from advocates. And I was hoping that you might be able to speak a little bit today. Let me try another mic. I was hoping you could speak a little bit today about some of the concerns that they've raised regarding limited opportunities for personal hygiene in terms of showering, limited opportunities to connect with family members, not being able to call or reach family members, and general issues of potential violence and self-harm, which you just spoke to, but Senators Suravel and Favola had sent a letter to Director Dotson asking for more clarity around many of those issues. So if you can provide some of your thoughts or insights on the large number of issues that have been raised by the family members that have reached out to us, that would be very helpful. Thank you.
Mr. Chairman, Senator Hashmi, thank you for the question first. I appreciate that. Thank you again for the question. I'm afraid I'm not going to be able to answer those questions in detail. I'm happy to take them back to Director Dotson, convey some responses back through your staff to those issues, take notes and give you that information. But I'm afraid I'm not going to be able to answer those specific questions today.
Thank you, and I would ask the letters that were sent from Senators Favola and Suravel if we could get answers to that list of questions that they had raised. That would be helpful to all of our offices because we still continue to hear from family members and from advocates across Virginia who would, I'm not in a position to provide the answers, and so clarity that either you or Director Dotson can share with us would be really helpful as we respond to the issues that family members have raised within our offices. Thank you.
Mr. Chairman, Senator Hashmi, thank you. And I will take that back to Director Dotson and convey your concerns to him. Absolutely. Thank you, ma'am.
Thank you. And I think I interrupted you. You were moving on to the career issues.
Yes, sir.
Career pipeline.
Certainly was. And this is an aspect of the proposal or plan, a presentation rather, happy to present to you on. This is the Virginia Community Colleges plan. So this is funding provided by the General Assembly to the agency to focus on building a pipeline from high schools and Virginia community colleges to employment opportunities with the Virginia Department of Corrections. This is something we're really excited about, frankly, Mr. Chairman, because this really aligns nicely with our vision for career recruitment, the idea of encouraging retention within our staff. And let me talk to you a little bit about that. We want to expand engagement to expose students, both in high schools and in community colleges, to corrections careers, developing skills aligned with workforce needs, and really fostering interest in corrections as a profession through direct interactions, education, and partnerships. The initiative will strategically increase awareness of corrections as a viable career path and really educate both the high school staff and also community college staff on what those opportunities are. We've developed a program to recruit and retain employees through educational partnerships. We'll use these funds for a variety of things that I'll talk to you a little bit about, but we think that this initiative is really crucial to encourage people to begin careers in corrections. Now, we talked a few moments ago about what our vacancy levels are. We think that this is an important step that will help us with that. There are 4 key areas that I have up on the chart that are for recommended actions. The first is that high school and community college partnerships. So it's establishing and really growing and strengthening partnerships that we have today with staff in high schools. That would be guidance counselors, teachers, principals, and in the community colleges, it would be those career counselors, coaches, and professors who would work with the students. And we're interested not just in students who are interested in criminal justice. We're interested in students in all professions because, again, the diversity of jobs and opportunities within the agency. We want to partner with those schools to offer corrections-focused workshops, We want to have educator and counselor engagement. So we recognize that those individuals are professionals in their own right, but they don't fully understand what our agency has to offer. So we want to take time to train them so that they can speak to their students about what those corrections pathways are, and to create a corrections educator work group that'll help. In other words, help us to share with them information that will help them to be successful. Likewise, the third item is student engagement. We already do some of these things, but this funding will help us to really grow that. That's things like career days at high schools. It's sponsoring school events, mock interviews for students, mock job interviews for high school students to prepare them for that real job opportunity, which may be their first full-time job. Likewise, public safety competitions and social media outreach to these young people to share information about what the opportunities are. And the final thing is always important to us. It's the fact that we take a data-driven approach to what we do. We look at what the data demonstrates, we monitor and collect that data, and then we try to identify schools and regions particularly that have the highest potential for recruitment. So we reach out to everyone, but we certainly want to maximize those school districts that are near our correctional facilities, near our district offices, places where the jobs exist, so we can bring those people into our workforce. This is really important to us, sir, because while the $250,000 will go a long way to supporting some of the programs that we already have in place and really growing and strengthening them to a statewide approach. And we're very excited about this chance to sort of more formalize that relationship with high schools and with community colleges to build our workforce. So this is something we were very pleased to report back to you on today, sir. Next item I have is the staffing study. So this is a study that we initiated the search for a vendor. The budget language, certainly in response to the budget language, the ADOC, the department ultimately contracted with an external vendor. We contracted with CGL Management Group, LLC, to conduct an independent staffing study that would fully address the required elements of the budget amendment. CGL's team, the team that they brought on site to do the study, it included retired directors of corrections, other senior DOC leaders and wardens from across the country, along with technical support staff with decades of corrections experience. These are individuals who ran correctional systems successfully for many years. They came to Virginia. They met with our staff, and they met with staff from corrections officer level up to wardens and senior leadership. They spent a lot of time at our sites. They went out to about 40% of our sites. They toured, they met with staff, they saw the unique needs and missions of those facilities. The study's primary objective was to recalculate and update the relief factors, those security staffing ratios, for each institution in addition to the other required elements. So they were tasked with providing a comparative assessment based on experiences with staffing models in other states, in other state prison systems specifically, to evaluate our approach and is there a better approach? We asked them to tell us how can we be better. The report was prepared. It's under final review to fulfill the requirements of Chapter 2. We did provide an advance copy to your staff last week. Apologize for not getting that to her until the end of the week, but it is finished. And as I'll tell you a little bit more about it now. What we have, sir, is we learned quite a bit. From the report, the department, the study highlighted that officers' roles have expanded. That includes counseling now, involvement in the inmates' programming needs. With the implementation of direct supervision philosophies, more officers are required in staffing allotments to have a continuous presence in housing units. And what the study demonstrated and what the CGL wrote about is the fact that provides a safer environment both for staff and inmates. With a growing number of inmates who require additional attention, extensive medical care, more supervision, our population that we're dealing with today, the study does recommend an increase in the number of correctional officers. The study recognized that VADOC is short-staffed at many correctional facilities due to our inability to hire, train, and retain enough staff to fill positions at certain locations. That is very specific to the geography. Some of our facilities are at full strength. Some of our facilities have very significant staffing challenges. The study recommended a calculation increase of 21% over the current relief factor. Now, what that means is they recommended an additional 1,353 FTE positions for the Department of Corrections to increase our staffing levels. So I'll tell you in the next couple slides how they reached that number, sir.
Okay, just
Yes, sir.
to level set, just to be clear.
Yes, sir.
You said 1,353 more staff needed?
That's security staff, yes, sir.
Oh, security staff.
Yes, sir.
Okay. So I wanted to be clear because the study stated that the department is currently funded for security staffing levels at full capacity of nearly 30,000 inmates, but the current population is 23,500. Does the lower population impact the number of officers needed at this time?
The study approaches it in quite a few ways. There's even a chart in the study, Mr. Chairman, that talks about each individual facility and based on what their staffing level is, how many inmates that facility can safely staff. So I think that they took a very comprehensive look at how that would be approached with the agency. Their final recommendation was for the 1353, but glad to give you more detail if you'd like. I hope that was responsive to the question you asked.
Okay. Yeah, why don't you continue? Sure.
All right, thank you, sir. So moving forward, an important element of the study is the shift relief factor. So this is the relief factor. Sometimes it's referred to as a ratio, but it's an essential element of the study because this was a key element that they looked at. With a shift relief factor, a shift relief factor indicates the number of full-time staff needed to cover a single post on a 24-hour basis, and we're talking about security posts here, on a 24-hour basis. So when you calculate that, what you're taking into account are employees who are off on leave, employees who are on sick leave, training needs, anything that can take an employee away from a post for a legitimate department business. You look at that, and then you figure or you determine the number of people you need to fill that post 24 hours a day, 7 days a week. So we've operated, in 1997, we were operating with 5.13. That was our relief factor. And we started with relief factor using a relief factor formula in 1974. So the department began that formula at that point. We were talking about looking at the same sort of analysis that I just explained to you. In 97, it was evaluated to be 5.13. And the last time that a formal calculation of records was conducted was in 2006, much like what we just did. So the last study before that was in 2006, and that was conducted by a company called MGT of America. So when MGT of America did the last analysis, they came back with a reevaluation, took us to 5.15. That's the 5.13 full-time equivalents to fill a post 24 hours a day, 7 days a week. We have adjusted it internally to 5.19, so that's where we operate today is 5.19 is our staffing ratio. And what the study has recommended, this is the 2024 study, is a ratio of 6.30, a shift relief factor of 6.30. And that's their analysis based on what they saw, our operations, and importantly, comparing us to other correctional systems. They came in, they looked at the staffing models that are in place elsewhere, which they were required to do with the budget language, and they were specifically asked to do. So they went out and looked and found 3 primary staffing models. And what they did was they looked at several states. They looked at the Pennsylvania Department of Corrections, Washington Department of Corrections, Iowa Department of Corrections, Minnesota Department of Corrections, Ohio Department of Corrections, South Dakota Department of Corrections, and then specifically at New Jersey's operation of women's facilities. They also looked at sort of the genesis of our current relief factor. They went back and looked at the National Institute of Corrections staffing model best practices, which was part of the impetus for where we were. And what they determined again was that based on our staffing level, our authorized positions of 6,983, and of that number, 5,763 are authorized correctional officer positions. The remainder are supervisory positions in uniform. That of that 6,983, they have recommended an increase of 1,353. And that is based primarily on the change to the relief factor that they've determined to be appropriate based on their analysis. So that certainly begs the question, so what is the agency planning to do moving forward? So our next steps right now, Mr. Chairman, are to revisit, and these are recommendations that were contained in the study, but they are revisiting and updating our post audits. So we will go out now and redo our post audits for our facilities in consideration of the information that's provided. We will probably not make adjustments immediately, but we will go back and look at our individual sites based on the study. And importantly, we're going to do some things with that. One of the things that they recommended, Mr. Chairman, is to take a look at some of the posts that we currently staff with correctional officers And they have told us that there are some other states that staff those same types of duties with non-security staff. Examples include property units, laundries, investigations, and intelligence posts. And what they've suggested to us is that, that you should consider you should consider looking at those and moving them to non-security positions. So we'll take a look at that and make a determination about whether that is something that would really work for our agency. Likewise, we'll look at our training hours. So we want to be efficient. We want to be efficient in what we do. Right now, we hire our employees. We do the majority of our training in a very structured environment for our security staff as they move through. But what they've suggested is there a way to streamline that. So we're going to go back and look at our training in partnership with DCJS. How are we doing that onboard training? How are we doing the training for the new employees? Are there ways to minimize those hours? Are there things that are extraneous there that we should remove, and can we do them in a better way? Likewise, we're going to look at if portions of our field training can be done in a different cycle. So what we do now is a lot of the training that happens at the facility level happens after they go through their academy. What they've suggested to us is that perhaps we should onboard the staff and do a lot of that facility-specific training first, rather than sending them to our training academy. And that's something that we're definitely going to look at. Seems to be very good logic in the approach that they took. So that's an opportunity for us there. Likewise, they've talked about two things that are organizational for us. They've talked about creating and implementing a centralized transportation unit. This would be a dedicated unit focused on moving inmates from one location to the other. A little different approach to the way that we do it today, but we're going to take a look and see if that really makes sense, and can we do that with the existing staff for our agency? Do we have the infrastructure to support it? The second thing that they've talked about within the study is creating a dedicated medical institution that would let us bring inmates from across the state to a centralized location in a secure environment, and then provide medical care to those inmates there. That could be Beaumont Correctional Center. That's been suggested. That would decrease the volume of external transportation activities. And then finally, the last one is conducting a statewide facility conditions assessment. So what they're suggesting is that we should be doing a study every 5 years of the statewide facility conditions, looking for opportunities for improvement, staffing, of really a variety of things. We do that in an informal way today, but they have suggested to us within the study that a best practice is to really formalize that on a 5-year plan. And I think that that's something the department is going to look at doing moving forward.
Let me ask you,
Yes, sir.
in what ways would establishing Beaumont as a dedicated medical institution decrease transportation? We'd
Okay.
save moving inmates there from other places, or?
Yeah, Mr. Chairman, the way that would address or would support us in the staffing perspective is this. For us to transport an inmate to an outpatient medical site, generally it takes 2 correctional officers. So if we're constantly taking inmates off-site to medical facilities for that, every time we move an inmate, generally is 2 correctional officers who will go with them to that location and stay with them for the entire time that they're there. Many states, what they do is they have a dedicated medical area, a medical facility. They'll bring the inmates there. It's inside the secure perimeter. You can maximize the use of your correctional officers. You establish clinics inside of those sites, and we have talked with UVA and VCU, some partner academic medical centers, about the possibility of doing something like that. But with clinics of that kind, you can provide those services to a large number of inmates in a fairly quick manner. They're inside the secure perimeter. You do not need the number of correctional staff to be with them off-site, for example, if they were at private healthcare centers or hospitals. And it's simply, from a staffing perspective, a better approach.
Okay, before I turn to Senator McDougall, I wanted to ask, right now we would have increased staffing needs at Beaumont, right? If we were to turn to that as a solution, we'd need more staff at Beaumont. So I'm wondering, given the higher security and medical staff vacancy rates in the Beaumont area compared to some of the other facilities, is there a recognition that we would need more medical staff?
Mr. Chairman, I think what is contemplated is perhaps moving staff from other locations to support Beaumont in the new mission, or a site in the new mission to do that. Okay.
Let me turn to Senator McDougall.
Thank you, Mr. Chairman. That's just about security staff. What about medical staff? Because if they go to VCU or UVA, they're the ones providing the medical personnel. How do we have the ability to either attract, hire, or staff a medical facility?
Mr. Chairman, depending on the location of the site, we generally do well with our medical staffing. We use contracts with outside vendors oftentimes. And depending on the location, we work closely with VCU, with UVA to do off-site clinics. For example, they'll bring in radiology trailers to do, x-rays, whatever the inmate population needs. We do that now at Fluvanna. We do that at other locations. So I don't know that it's going to be, we would stand up, for example, a clinic that would full-time do this. What you would probably see is we would contract with a vendor who would come in routinely and perform the services there, and then they might perform the services for other agencies or entities as well. So I don't know that they would necessarily be Virginia Department of
Senator
Corrections
McDougal, did you
employees.
want to follow up?
Yeah, Mr. Chairman, thank you. So how does that factor into the cost savings? Because right now, if an inmate has a medical situation that requires inpatient care or out of the facility, then they're transported to that facility. And I think that we've gone through a number of situations where they're eligible for that to be paid for by Medicaid in certain situations. What's going to be the cost from this direction? Because I hear you talking about the security side, which makes sense to me. I'm not hearing about the cost on the medical side and the type of performance that'll be.
Okay, and Mr. Chairman, Senator McDougal, let me be careful to draw a distinction between inpatient versus outpatient. And let me preface this answer by saying I'm not a healthcare provider. But with inpatient services, that's different. We would rely on a hospital setting. We do not have a facility in the Department of Corrections where we would necessarily provide long-term inpatient health care of that type with advanced care. We don't provide that type of service. Outpatient treatment and things are what we would generally talk about in the clinic setting. They could be dental clinics, they could be x-rays, it could be things that you and I would go to a doctor, we would have the service performed, and then would return home. So it would not be somewhere you would stay for an extended period of time.
Mr. Chairman?
Yes, Senator McDougal.
How much are we using those, what we would refer to as more x-rays or things of that would be just a doctor's visit? How many of those types of things are we doing outside of facilities now?
Mr. Chairman, I do not have the exact number, but I'm happy to obtain that and provide it to your office, sir.
Mr. Chairman, thank you. I guess we've had this conversation about healthcare being the single largest expense driver in Department of Corrections. So I have some real questions about this. I do think there's a lot of logic to making sure that we are providing the best healthcare because I think long-term that's cheaper, but I'd like to see a lot more information about this before I'd feel comfortable personally.
Thank you, Senator.
Mr. Chairman, happy to provide that to you, sir. We can stop by your office if you'd like and make sure we understand specifically what you'd like to have and then provide that to you, sir.
Thank you.
Mr. Chairman, that concludes the comments in the presentation, but happy to answer any other questions that you may have.
Justice coming up next. Were there other questions? Okay. Thank you for being here today, and
Thank you,
for the
Mr. Chairman.
information.
We appreciate the opportunity.
And your
Have a
work.
great day, sir.
Yeah. I've got a list of 5 DJJ staff. I don't know if Autumn Kaufman is presenting first, or if introduce yourself. Come forward.
Good afternoon, Chair, members of the committee. My name is Andrea McMahon. I'm the Deputy Director for Placement and Program Implementation.
Can you speak into the mic just a little bit?
Sure, I know I'm quiet. Andrea McMahon with the Department of Juvenile Justice.
Okay.
Here with several of my colleagues to present to you on several topics today. I have the honor of presenting an update regarding alternative placements for our youth who have been committed to DJJ. Can you hear me okay?
Yeah. Maybe if you pull the mic forward just a little bit, it might.
Better? Okay, thank you. Okay. I'm here to present on alternative placements for our youth that are committed to Department of Juvenile Justice. We continue to prioritize the most appropriate placement based on treatment needs with our alternative placement programs. As you will see on this slide, this is a quick outline of our alternative placement options. We have 19 juvenile detention centers that partner with us for intake services out of 24 local or commission-owned juvenile detention centers. We also have 6 community placement programs, and those are small self-contained programs across the state. We have also expanded partnerships with 5 detention centers to develop what we are referring to as individual bed placements. These are programs where the youth can stay close to home, and we contract out for services to come into the program. These services are encapsulated with our regional service coordination model, which we contract with evidence-based associates, who then establishes contracts across the Commonwealth for community-based, but then also residential treatment centers, which we can access for our youth. And then we also have revitalized detention reentry programs across the Commonwealth with 5 different detention centers as a step-down process for kids to return to the community. This next slide just outlines more detail of these programs. Our 6 CPPs are scattered throughout the Commonwealth. We have Blue Ridge Detention Center, which is in Charlottesville, Chesterfield, Newport News, Prince William, Shenandoah Valley, which is in Stanton, Virginia, and then Virginia Beach Detention Center. We are currently exploring an additional CPP in the Eastern region to increase our capacity for alternative placements for our youth. We've been able to additionally expand our options through individual bed placements, which we have located in Highlands, which we're very proud of that. It's in far southwest Virginia and Bristol. And then we also have Merrimack, JDC in Williamsburg, Northern Virginia in Alexandria, Piedmont, which is in Farmville, Virginia, and then Rappahannock, which is just north of Fredericksburg and Stafford. And then as you'll see, the 5 detention centers that we partner with as a step-down detention reentry program include Blue Ridge, Norfolk, Rappahannock, Richmond, and Shenandoah Valley. And as you'll see for the residential treatment centers, we can access those through our regional service coordination models. So through our today's population, we have youth that are at Hallmark Youth Care, which is based kind of western part of Richmond, Newport News Behavioral Health, and then we have youth at Elk Hill Residential Group Home. To give you some information based on our average daily population, or ADP, as you'll see, since 2015, the average daily population of direct care and alternative placements has increased from 8% to 44%. As you'll see, it kind of took a decline through COVID, but it has been steadily increasing as we've emerged from COVID. FY23 ADP was 79, with it increasing to 125 in FY24.
That's right. With the changes in placements over the past decade, has DJJ done an assessment comparing the costs of each placement type?
Cost of the alternative placements, or cost as a whole?
Of each type, yeah.
Yes. If I could
Sure.
ask our Deputy Director of Admin and Finance, Nakia Jones, to speak more to that.
Welcome.
Mr. Chair, yes, we have completed an analysis and an assessment, and it shows, through COVID, or as we emerge back from COVID years, that, we need to look at some things differently. So those evaluations and those assessments, even kind of looking at bringing some things back in-house, that's what we are currently investigating. But it's fair to say we have not made any decisions, just realizing that we're going to have to switch gears with our allocations.
Thank you.
Thank you.
Thank you, Chair. And then before I pass to the next colleague, I did want to speak to our placement algorithm. In response to JLAC recommendations, we developed and implemented guidelines to develop a placement algorithm to inform our placement decisions. The algorithm incorporates the youth's risk, criminogenic needs, responsivity, and commitment type, their treatment needs and vocational programming, Staffing teams use the guidelines to ensure consistency in placement decisions. This allows us to maximize the placement options and ensure we match the needs of the youth to the most effective placement. Decisions are also reviewed through a central case management review process to ensure fidelity to the guidelines. And then following the staffing process, we have also implemented pre-placement services for youth that we partner with at the JDCs pending transfer to their placement location. We're able to use community-based services to engage the youth and preparing them to engage in their treatment location. So we're really excited to be able to implement those services to the youth as they go into their treatment. And any questions before Deputy Director McNeil comes up? Thank you.
Thank you. Good afternoon, Mr. Chair and Committee. Ashaki McNeil. I am the Deputy Director for Reentry and Interventions, which also includes workforce. And I'm just going to give you a couple of updates, starting with our Behavioral Services Unit, which is comprised of licensed clinical staff who are responsible for providing mental health services, assessments, evaluations, and treatment to our kids at Bon Air. As a result of recommendations from JLARC, we engaged with DPB to do an independent analysis on those services, and we are currently awaiting those findings. We have not received them as of yet. But in the meantime, we took some necessary steps to address the needs of our kids at Bon Air, starting with adjusting our therapist hours to provide additional support when critical incidents are occurring in the facility, and increasing our staffing to support mental health needs. This includes putting more resources in our behavioral services unit so that we can provide kids with the services they need. As I was mentioning before, we added to our behavioral services unit staff as a result of some data that we pulled. What you will see here is that we found that incidents were occurring in Bon Air between the hours of 7 o'clock p.m. and 8:59 p.m., with the majority of those incidents happening on Saturdays and Sundays. So as a result, we increased the number of our therapists who are working on weekends and who are working late evenings. And then the last update that I will give is around our workforce. We now have vocational programs that are available in all of our placements. This includes plumbing, electrical, HVAC, barbering, carpentry, construction, and welding. Kids who complete the program can leave with at least a minimum of a level 1 certification. We use a nationally recognized curriculum so that when they are released to the community, they can continue with that curriculum. We at Bon Air, we offer a hands-on program, but in our placements in the community, we're using more of an online program. In Bon Air, we have what we call real life, hands-on plumbing, electrical, HVAC, carpentry is coming. Those programs, of course, they're in limited space, and so there is a need to increase that space so that our students can benefit from an expanded work area. And then last but not least, the thing that we're working on in 2025 is reinstating the institutional and community furlough work programs so that our kids can expand their skill sets and gain experience to prepare for release.
Can we go back to, on slide 7, I'm just wondering, does
Yes.
DJJ have data on the usage of lockdowns and in-cell time, especially with the 50% staff vacancy rate at Bon Air?
Yes, we do have that data. Unfortunately, I do not have it with me, but I can make sure that we take a note and get that information to you.
Thank you. Thank you very much.
Okay, any other questions? No other questions. I will pass it to my colleague, Autumn Kaufman.
Thank you. Welcome.
Good afternoon. My name is Autumn Kaufman. I'm the Director of Behavior Analysis. And over the past 8 years working at DJJ, my team and I have been responsible for the implementation of Positive Behavioral Interventions and Supports, or PBIS. PBIS aligns with the community treatment model philosophy, and it has a strong focus on fostering positive relationships, facility-wide structure, clear expectations, and consistent feedback. It serves as an implementation framework for us as well for maximizing the selection and use of evidence-based prevention and intervention practices along a multi-tiered continuum that supports the academic, social, emotional, and behavioral competence of everyone. It brings together all areas of the facility from recreation to education as well as treatment needs. And this is accomplished by teaching expected behavior across all contexts, providing feedback when the expectations are met, as well as feedback when those expectations are not met. Our initial implementation began in the Division of Education in early 2018, and a little over a year later, we were able to see some significant decreases in the frequency and the duration with which students were removed from the school setting due to disruptive behavior. And just a few months ago, we began our implementation across all areas of the facility, which expanded from the designated school days and times to a 24/7, 365 operation. We are currently sitting at 31% implementation of Tier 1, and we know from the field of implementation science that it usually takes between 3 to 5 years to reach full implementation, so we are continuing to monitor our rate of implementation over time. And we're currently progressing as sustainably as we can with the available resources that we have. From July to October, we've seen a 15% decrease in total chargeable offenses and specifically a 47% decrease in fights during that time. We know that consistency is the key to success, and so we are working to build internal capacity across all shifts, all divisions, and all of our staff. So we also offer weekly and monthly incentive events to our residents to help motivate participation, and so this slide shows some of the different events that we've offered. On average, 52% of our residents are eligible for weekly opportunities, and 33% of our residents are eligible for these monthly events. This typically means to be eligible that our residents have been at Bon Air for at least 30 days and have remained charge-free during that each 30-day time to be able to access and attend these different events. Here are some pictures of the actual events in place that we wanted to make sure that we shared to show some of the work that we've done. And if there aren't any questions for me.
I do have a question.
Sure.
In 2021, it's my understanding that JLARC found that the community treatment model had not been rigorously evaluated and that DJJ lacked sufficient staff and staff training to implement the model effectively. I'm wondering if there have been any changes since then, since 2021, based on those JLARC findings. Has the staff had more training on implementing it, or?
Thank you for the question. And what we've done with the facility-wide PBIS model, it is a rigorous evidence-based behavior management system that we've aligned with the CTM philosophy, and that has changed our training that we've offered to staff. So we did an initial training when we began our implementation this fall, and that has now been built into our annual reservice training, as well as our officer field training that takes place when they come to us at the facility, and is continued to be offered to all of our new hires as well.
Thank you.
Yes. Any other questions?
I'm not on this portion. Thank you.
Okay, thank you. I'll turn it over to Dr. Deontay Johnson.
Good morning, Mr. Chair.
Good afternoon.
I'm sorry, good afternoon.
That's okay. I like
It's been a long
enthusiasm.
day. All right. So today I'm going to talk to you a little bit about the Aspire Intervention Program. It was designed to address gangs and violence within the correctional center. It is built within the framework of the PBIS, and so we found that it is very effective amongst the residents within the program. Last year, before this committee, we discussed the exploration of this being implemented as a pilot. June of 2023 is when we implemented it, and we saw really good results that was given back to us by our behavior analytic team. we saw that the aggressive incidents among residents that actually participated in the program actually was reduced. And so since then, we have expanded upon that program when we presented last year, we intended to do so. So that expansion included offering the program in 3 different cohorts, spring, winter, and summer, during the school breaks, which is the initial way that residents will enter the program. Also adding the housing unit component to this for residents that desire to have additional support. In addition to that, adding a female component to the program specific for the female population. In addition, we also looked at the residents remaining in the program until they're transitioning out to wherever they're going, whether it's their step-down facility back into the community or transition into DOC if they have a blended sentence. So we have been able to expand this. We've also added additional staffing to support the program, 2 additional staff to make sure that we're meeting the needs. Thus far, we have had 25 releases for step-down since its inception, and 54 active participants in the program to date. As we move forward, we would like to explore a continuum of care. So not just ending the services with the residents as they transition out, but to continue those services when they go back into the community. So we are looking to expand into the community placement programs, as well as if we have apartment living programs, as well as providing additional transition specialists that can support the residents while they're in our care. That actually concludes my portion of the presentation. Do you have any questions for me?
Thank you.
Thank you. And I'll pass it on to Deputy Todd.
Thank you. Thank you, Deputy Todd, Deputy Director.
Good afternoon, Mr. Chair. I am the Deputy Director for Education and Rehabilitative Care for the Department of Juvenile Justice, and I'm here to talk a little bit about Bon Air and our impacts. So, as you heard our colleagues at DOC indicate, staffing is a concern for all of us, and they actually touched on quite a few things that I was very excited to hear, because you guys are going to hear it twice now. All of the areas that we work in Bon Air need the security staff to be successful, right? So if you don't have security staff, but you have lots of medical or you have lots of BSU, which we also have issues with, but you still can't do the programming that you want. You need to have the security staff in order to effectively provide the programming that we need to provide to the kids. The perception of safety, whether it's accurate or not, is a reason cited on a number of occasions for low morale and turnover. Security staffing improvements could improve retention for all the areas, not just for security, but also for education, for medical, BSU. We are doing well with what we have, but we could do more program. We could expand, like my colleague Deputy McNeil mentioned, expand the vocational training if we had more security staff in order to supervise, as well as other programming with volunteers or other incentive programming that Ms. Kaufman indicated. It could also improve, again, staff morale and reduce turnover. It will also improve resident morale because they would get additional attention from the adults that are the only trusted adults that they see 24 hours a day. Example of a resident that went off to the hospital like in the middle of the night. So we had the staff to cover the facility. When we need to send staff out unexpectedly like that, it does stretch things. And everything, we are able to handle it, but it does make it difficult to plan for the individuals who are at the facility. As you heard DOC mention, having the right number of positions for just to cover a 24-hour shift is important, not only to, because obviously you need a person for every hour of the day. But when you have people going out, when you have people calling in for one reason or another, you need that sort of buffer in order to make sure that you have enough staffing. So we are hoping that we can improve our staffing. We lose people to DOC, and they are bigger and can absorb the loss, the turnover that they experience a little bit better than we can with one facility. We lose people from one facility, we can't move them from another. My next slide, okay. Oh, here it is, I see it, sorry. Okay, so we have seen an increase in the treatment need completion during direct care. What you have in front of you is fiscal year 2019 through fiscal year 2024, and you can see that it has gone up significantly since fiscal year 2019 with a distinct increase starting in fiscal year 2022 up through 2024. Both in aggression management and substance abuse. As you can see, it is now above 90% or right around 90% or above for both aggression management and substance use, sorry. In addition, our risk assessment change during direct care is a positive improvement. We have seen improved strengths from fiscal year 2019 through fiscal year 2024, as well as reduced needs. And that change is significant as well, going from 50 to 60% up to 81 and 83%. Another change that we've seen since the LOS guidelines have changed is an increase in the number of indeterminate commitments as opposed to blended or determinate commitments. When Director Floriano came to the department, she felt through her connections, her experience with judges, that there was a lack of confidence that when a child was indeterminately committed, that we were providing everything that was needed to be provided, because some of the lengths of stay were quite short. And since we've implemented the length of stay, the new length of stay to require the treatment program completion, vocational completion, the amount of the ratio certainly is way higher in indeterminate versus the blended and the determinate commitments. And it's our conclusion that that is a direct result of the increased confidence that the judges and the prosecutors have in sending kids to the department without a specific amount of time, with the discretion of the department to release them when appropriate. Oop, I skipped. No, that's okay. We've also seen a dramatic reduction in the youth with firearm offenses. It is the largest, as you can see, in a decade, and that has stemmed from the implementation of a directive from Director Floriano. Wow. Not long after she started with the agency, she put in place a mandatory detention for firearm offenses. Obviously, that means that the judges can release them, but we would not release them initially. We wanted the judges to be able to have the opportunity to hear the full sort of picture before deciding whether or not those individuals should be released back into the community and under what conditions they would be released. Also, well, yeah, that's all there is on that. And in addition, sort of related to that is also the reduction in juvenile homicide victims by homicide type here, but you can specifically see that the firearm-related murder and non-negligent manslaughter and the firearm-related negligent manslaughter have both gone down significantly since 2022 when Director Floriano began with the department. The only firearm-related homicide that actually went up is the justifiable homicide, interestingly. So That is all I have for you, and I am the last one. So if you have any questions.
Senator McDougal.
Mr. Chairman, I'm looking at those numbers, and maybe I look at them a little differently. I'm looking at them over the last 10 years, and it looks like since 2020, the numbers are significantly higher than they were at any point between 2013 and 2019. So I guess I would look at those and see that the number of homicides being committed by juveniles over the last 4 years are significantly higher than we were seeing historically.
Yes, Mr. Chairman, they are higher, but they have gone down since Director Floriano came into the agency. Yes, that's correct. They are higher than they were, but they have significantly decreased since 2021.
Mr. Chairman, another question. There was a Court of Appeals case that came out, I guess, in the last 2 weeks that talked about using juveniles' prior adjudications of being delinquent in subsequent prosecutions and whether they receive mandatory time. Have y'all had any conversations about the fact that a number of prosecutors will probably now move to certify juveniles and as opposed to trying them as juveniles because those convictions cannot be used in the future, and what impact that'll have to the system?
We haven't had that conversation, but I would certainly take that back.
Mr. Chairman, I probably ask that they have a conversation about that case and come back to us.
Okay, thank you, Senator McDougal. Please do. Okay. I believe that completes our, Senator Hashmi. I'm sorry. Yes.
It's okay. Just for our final speaker, is it possible to get a breakdown of the localities that are impacted by each of these, the firearm-related data points? Is it possible to get a breakdown by locality where we're seeing the decreases or increases in
Potentially, we can certainly bring that back to our, what is her, I can't remember her title, but the research manager and that group to see how far they can break it down. Sometimes we have to do it in larger chunks to make sure that there isn't too much potential for identification.
Okay, yeah, we'd like that information by locality, and if maybe region too would be a intermediate point. Yeah. Okay. Thank you.
The homicides or the firearm offenses?
The
Or
firearm offenses and homicides, both?
the final page?
Mr.
Or you all,
Mr. Chairman, I think Senator Hashmi had a great idea, and so if we could have it for the firearms too, that would be great.
thank you.
Thank you. Okay. I believe that completes our business of the subcommittee, so thanks for attending for the presentations today.
The Senate of Virginia, Richmond, Virginia.